Kash Patel here, confirmed, and we're also going to have Robert F. Kennedy Jr.
On Hilliard, if there's information that Donald Trump has shared with journalists on background or otherwise, him.
Zero evidence that has been presented, and he himself, I think we need to be very, very clear, said himself there from the White House today that he didn't know himself whether this had anything to do with the so-called DEI hiring initiatives. This the president today, 1 week after his inauguration, hours after more than 60 people were killed just 5 miles from the White House, he equated the tragedy and placed blame on non-white,
while calling for greater transparency and accountability in our public health infrastructure. Mr. Kennedy has an important opportunity to reform the department and to restore trust in our federal health agencies. I look forward to hearing more about his policy priorities and his plans to advance President Trump's agenda to make America healthy again. I thank you for joining us today, and I'll now turn over to Mr. Kennedy to introduce himself. Is your microphone on? Is your microphone on?
Thank you, Chairman Cassidy. Thank you, Senators, ranking members, and ranking members, Senator Sanders, and other members of this distinguished committee. Cheryl and I were heartbroken last night to learn the tragic accident that took so many of our fellow Americans, including our service members. We are in an apartment where we were able to see the rescue operations from our window. Senator Marshall, please know that I will continue to pray for you, as I texted you last night, for those who were lost, who called your state home, as well as Senators Kaine and Brooks. We appreciate the first responders and local officials who are working so hard. May God continue to be with us all who are impacted, and those who continue to help with the recovery. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I'm grateful to have my family here once more with me. I want to introduce my wife, Cheryl, my daughter, Kik, my son, Bobby, my daughter-in-law, Amaryllis, and my nephew, Jackson Hines. I want to thank them, as well as the many members of my large extended family, for the love they have so generously shared. I want to particularly thank you, Mr. Chairman, for the time you've spent with me and the times we've talked in person and by phone. I greatly admire your passion for public health and your commitment to science. And this committee is blessed to have a medical doctor at the helm and two other medical doctors, Dr. Marshall and Dr. Rand, on the committee. I explained yesterday to the Finance Committee that my journey into the issue of health began with my career as an environmental lawyer, working with hunters and fishermen and mothers in the communities and small towns along the Hudson River. I learned that human health and environmental health are intertwined and inseparable. The same chemicals that kill fish also sicken human beings. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than in 1960. Cancer among young people is rising by 1 or 2% per year. Autoimmune diseases, neurodevelopmental disorders, asthma, Alzheimer's, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise. The United States has worse health than any other developed nation. Yet we spend more on healthcare, sometimes double, sometimes triple, as other comparable nations. Last year, we spent 4.8 trillion, not counting the indirect costs from missed work. That's almost a fifth of GDP. It is tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for their health care and yet have a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to resurrect America's global strength and our leadership and to restore the American dream. And he understands that we can't be a strong nation unless we're first a healthy people. A healthy person has 1,000 dreams. A sick person has only one. Today, over half our countrymen and women are chronically ill and have only one dream. When I met with President Trump last summer, I discovered that he is more than just a concern for this tragic situation, but genuine care. President Trump has committed to restoring the American dream, and 77 million Americans delivered a mandate to do just that, due in part to his embrace and elevation of the Make America Healthy Again movement. That movement, led largely by moms from every state, many of whom have traveled to be here yesterday and today. Senators, this is one of the most powerful and transcendent movements I've ever seen. The nation is ready for change and recognizes that this is a unique inflection moment. I promised President Trump that if confirmed, I will do everything in my power to put the health of America back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, both Democrats and Republicans. I came away from our conversations hopeful that we can put aside our divisions for the sake of a healthy America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20% of GDP, there are no good options, only bad ones. Shifting the burden around between government and industry and corporations is like changing deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change course and ask the fundamental question, why are healthcare costs so high in the first place? The obvious answer to that question is chronic disease. The CDC says over 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all Americans healthy again. There is no single culprit for chronic disease. Much as I've criticized certain industries and agencies, President Trump and I know that most of the scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure this committee is clear about a few things. News reports and many in the hearing yesterday have claimed that I'm anti-vaccine and anti-industry. Well, I'm neither. I'm pro-safety. I'm pro-good science. I worked for 40 years to raise awareness about mercury and other toxics in fish, and nobody called me anti-fish. All my kids are vaccinated. I believe vaccines have saved millions of lives and play a critical role in healthcare. Nor am I the enemy of food producers. American farms are the bedrock of our culture and our national security. I was a 4-H kid, and I spent my summers on ranches. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed if we do not have the partnership of America's farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions, and I'm not going to apologize for that. We have massive health problems in our country that we must face honestly. And the first thing I've done every morning for the past 20 years is to pray to God that he would put me in a position where I can end the chronic disease epidemic and protect our children. That's why I'm so grateful to President Trump for the opportunity to sit here before you today and seek your support and your partnership in this endeavor. I'll conclude with a promise to you, Mr. Chairman, the members of this committee, to the President, and most of all to the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives to our food supply. We'll remove the financial conflicts of interest from the agencies. We'll create an honest, unbiased, science-driven HHS, accountable to the President, to the Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. I'll start. And for everyone's information, yesterday, finance went long. This is not the Star Chamber. This is where I think most people can get their questions out in 5 minutes. And so I'll let it go a little bit over 5, but out of deference to our witness who's already testified for 3 hours, I'll be a little tight. That said, at the end, taking the ranking member of the chairman's privilege, we will have a chance, the two of us will have a chance to ask a little bit more, and that's what you get for being a chair. So that said, let's begin. Bobby, if I may, because you said I could, you had once described yourself as pro-vaccine to me. Now, the context of what I'm about to ask is that there's multiple studies establishing the safety of measles and hepatitis B vaccine, and specifically that they are not a cause of autism. In this position, and you have previously said yes, but if you are approved to this decision, to this position, will you say unequivocally, will you reassure mothers unequivocally and without qualification that the measles and hepatitis B vaccines do not cause autism?
Senator, I am not going into the agency with any.
Well, that's kind of a yes or no question, because so if you're, because the data is there, and that's kind of a yes or no. And I don't mean to cut you off, but that really is a yes or no.
If the data is there, I will absolutely do that.
Now there is the data, just because I used to do hepatitis B, as I've said. I know the data is there.
Well, then I will be the first person. If you show me data, I will be the first person to assure the American people that they need to take those vaccines.
Now, what concerns me is that you've cast doubt on some of these vaccines recently. I mean, like the last few years, but the data, and I can quote some of it. The data has been there for a long time. I've been out of the game. I've been in Congress for 16 years, and this data was in large measure generated before I came to Congress. So my concern is that if you were making those claims and being so influential, I mean, your bully pulp is incredible. With that responsibility, that you never acquainted yourself with anything that might contradict that what you were previously saying. So let me ask once more. If the data is brought to you, and these studies that have been out there for quite some time and have been peer-reviewed, and it shows that these two vaccines are not associated with autism, will you ask, no, I need even more? Or will you say, no, this, I see this, it's stood the test of time, and I unequivocally and without qualification say that this does not cause autism?
Not only will I do that, but I will apologize for any statements that misled people otherwise.
Thank you. Next.
Now, I just want to pledge to you that I will never stick on a point if somebody shows me data that says I'm wrong. I know that's an interpretation people have, but it's absolutely wrong. I'm science-driven and evidence-driven.
I think the concern is how persuadable people are. But let me go on because I have limited time. I'm going to hold myself to the same 5 minutes. Yesterday, Senator Bennett in Finance asked you if you had once previously made statements that Lyme disease was created as a military bioweapon, and you said you may have said that once. Do you still believe that Lyme disease was created as a military bioweapon?
I've never believed that, Senator. What I said is that we should always follow the evidence. There were 3 books suggesting that. I have not read them through, What I've said is we should always follow evidence, no matter what it says. No, I never have said that definitively Lyme disease was created in a biolab.
Okay. Next, again, this will be kind of a yes or no. Do you commit that you will revise any CDC recommendations only based on peer review, consensus-based, widely accepted science? In other words, not personal beliefs or the beliefs of any single person that you or your department may identify?
Absolutely, Senator. I am not going to go into HHS and impose my preordained opinions on anybody at HHS. I'm going to empower the scientists at HHS to do their job and make sure that we have good science that's evidence-based, that's replicatable, where the raw data is
I'm almost
published.
out of time, so let me get to another question.
All right.
Do you promise that FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms?
Well, we will have the best vaccine standards with safety studies, and I will not, if the
That's a little bit of a different answer than the question I asked, because what is the best could be in the eyes of the beholder. So let me read again. Promise that the FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms.
Yes.
Great. With that, I will set a good example, and I yield my time to. Thank you,
Sanders.
And I'm going to do what I very rarely do, is actually follow up on a question from Senator Cassidy. There have been, as I understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. Studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response, because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right. Let me ask you another question about this one about COVID. Scientists with the Yale School of Public Health and University of Maryland have estimated that the COVID vaccine saved 3 million lives and prevented 18 million hospitalizations. President Trump, someone who I do not often agree with, has said that the COVID vaccine was, quote, one of the greatest miracles. Donald Trump. But Bobby, you had a very different perspective. At a time when thousands of Americans were dying from COVID every week in May of 2021, you petitioned the Food and Drug Administration to revoke the emergency use of COVID vaccines. So my question to you is, were the scientists who told us that the COVID vaccine was imperative, and President Trump who told us that it was this great thing, were they right, or were you right when you told people